Hi, everyone. Alternavita. Thank you for stopping by and thank you for your time. I'm having some lighting issues today, so I'm hoping I can just stay in one position and not have the light affecting the video so much, but it appears that even scrolling might make things look a little different, so I apologize for that. This week's topic are some food-based supplements that you might find help to enhance your oral natural immune therapy. And one of these food-based supplements in particular are mushrooms. I have recommended mushrooms in the past, specifically button mushroom, Agaricus bisporus, because of its unique ability to scavenge hydrogen sulfide. So Reishi, in ancient Chinese culture, Reishi symbolized good fortune and mystic power. It was revered for its medicinal and spiritual significance. The fruit body, which is rich in bioactive compounds, was traditionally used for various ailments. However, studying the spores deemed the most valuable part of the fungus posed challenges due to extraction complexities, but recent advances in spore-breaking technology have unveiled higher concentrations of bioactive elements, underscoring the importance of further research or maximizing their potential benefits. So 5 proven capabilities Reishi can ways that Reishi can enhance natural oral immune therapy. And this would be your daily colostrum drink. I find that it's just, if I want to add something, it's usually just easier to add it into my daily, or however often you take your oral immune therapy drink. It's easier just to add whatever else you want to add into that. So the fruit body of Reishi was renowned for its bioactive compounds like sterols, triterpenoids, fatty acids, and carbohydrates. It was valued for its efficacy in preventing and treating various ailments such as liver disorders, hypertension, insomnia, diabetes, and cancer, and its pharmacological activities have long been recognized for their beneficial impact on human health. So mostly Reishi is known for its anti-cancer properties, but today there are many ailments and conditions being studied with Reishi in mind. So the polysaccharides of Reishi are the most reported components of immunological activity. And in my first paragraph here, I have the link to a review of the research, and you can read all about the different types of Reishi extracts, powders, fermented components, and you can see in one paper pretty much what they know so far about Reishi. But just 5 of the beneficial effects that have been studied are the immunomodulatory activities of Reishi, and that is due to their effect on the gut. So they increase macrophage activation and phagocytosis. They have gut microbiota modulating activities, increasing beneficial bacteria such as bifido. They have immune enhancing effects on both the innate and cellular immunity, and significantly increase the bacteria firmicutes ratio in the gut. The oleosaccharides can also be considered as an effective prebiotic, and treatment with these resistant starch spores reduce blood glucose. And spore powder significantly inhibited body weight from increasing under a high-fat diet by altering the gut microbiota and improving metabolic health. One thing I'm just going to add to this before I forget, they also protected the intestinal barrier integrity. So this is another study that was included in that I found probably the most interesting regarding gut health. And it reduces obesity in high-fat diet-fed mice by modulating the composition of the gut microbiota. Obesity is linked to chronic inflammation and intestinal dysbiosis. Reishi, a medicinal mushroom, is believed to have anti-diabetic properties. So let me just go back here and go over some of these other effects. If I didn't say that, it was believed to help various ailments such as liver disorders, hypertension, insomnia, diabetes, and cancer. Can't remember if I read that or not. So Reishi reduces body weight, inflammation, and insulin resistance in a high-fat diet. And high-fat diet-fed mice, and the reishi not only reverses gut dysbiosis by reducing the firmicute to bacterial ratios and proteobacterial levels, but also enhances intestinal barrier integrity and decreases metabolic endotoxemia. The modulating effects were transferable via the feces from the Reishi-treated mice to the high-fat diet-fed mice. So that was one. That is another thing I found interesting, that they could cause and reverse just with fecal transplants from the Reishi-fed mice. So moreover, the high molecular weight, polysaccharides exhibit similar anti-obesity and microbiota-modulating effects. These findings suggest that reishi and its high molecular weight polysaccharides could serve as prebiotics to mitigate gut dysbiosis in obesity-related metabolic disorders in obese individuals. So that's something else I want to tell you while I'm here. I did add a featured section on metabolic health on the homepage of Alternavita. And once you learn these particulars, you will understand a lot better about how this might be working. And I just want to say that fat in particular can change your microbiota function immediately, either to cause or reverse certain factors. So our findings, supported by the transferability of anti-obesity effects through fecal transplantation, indicate a relationship between obesity and altered gut microbiota. This aligns with recent research which demonstrated larger weight gain and higher obesity associated metabolic disorders receiving the microbiota from obese individuals. That study, where they caused and reversed different conditions, namely obesity, just by fecal transplant. So high-fat diets, particularly bad fats, induce chronic inflammation and obesity-related disorders, and attributes this is attributed to dysbiosis and increased levels of LPS in the blood, termed metabolic endotoxemia. So supplementation improves gut barrier integrity, reduces endotoxemia, increases toll-like receptor 4 signaling, and mitigates inflammation in obese mice. Okay, so how does it work in particular? It reduces pro-inflammatory macrophages, MCP1 expression, and enhances IL-10 and Treg cells in hepatic and adipose tissues. It restores firmicutes to bacteria, reduces inflammation-associated species, and the polysaccharides exhibit significant anti-obesity, insulin resistance, and lowering glucose. And more specifically, it reduces the number of pro-inflammatory macrophages, decreases expression of monocyte chemoattractant protein, inflammatory proteins, enhances IL-10, and regulates T cells. And it demonstrates that it restores the ratio to levels similar to those in lean mice and enhances beneficial species such as Clostridium clusters, Roseburia, and reducing inflammation-associated species like Escherichia and Acinetobacter species, and that also included E. coli in another study. So it reduces the expression of genes involved in fatty acid synthesis and improves insulin sensitivity in high-fat diet-fed mice. So these effects may be mediated through the modulation of lipogenic gene expression and insulin signaling pathways. And then again, it acts as a prebiotic to alleviate obesity, chronic inflammation, and insulin resistance, as well as glucose in obese individuals. So that's just another proof of concept that fecal transplants. There are at least 4 pillars, maybe 5. Trying to remember. 4 or 5 pillars where they have done the same thing with simply fecal transplants alone. And this just further demonstrates that. So how do you use it and what do you have to look out for? So you can choose pretty much any type of reishi you prefer, whether that's powder, extract, fermented, what have you. And the recommended daily dose is 2,000 milligrams per day. That's only a teaspoon of reishi powder or 3 capsules. So you can just add the powder to your natural oral immune therapy. It disguises the taste very well. It incorporates very well into the drink, and probably most importantly, you can't taste it if you don't like the particular taste of reishi. That helps disguise the taste quite a bit. And generally, you will not see any results in until 4 to 8 weeks. So this was the specific parameters pretty much of this particular study. So, and if I remember correctly, in most of the studies, the benefits weren't seen immediately. So another thing is, don't forget to check with your doctor. Reishi effects Reishi does have quite a bit of different effects on hypertension and things like that. So you might want to check with your healthcare provider or pharmaceutical pharmacy to make sure you can safely take reishi, especially if you have a history of cancer. So, okay, I think that's pretty much it. And I will have another one next week regarding fermented reishi in particular. And the results were even more, the results not only showed some of these same things, but it was also very interesting on how much reishi could improve gut health. So I would suggest, as for any supplement, even though it's food-based, you take it for a few months and then give yourself breaks. Colostrum milk, kefir, and yogurt is about the only supplement where you should not have to take a break for any reason, but and beneficial oils are another one that you might want to take different ones at different types of the year, especially when it comes to like cod liver oil, but you can pretty much safely take beneficial oils such as fish oil, salmon oil, cod liver oil, olive oil, avocado oil. Those are all healthy food-based oils, and they will also help you regarding some of this inflammation and things like that from these particular studies, which study in particular high-fat diets. So the beneficial oils also help to enhance your daily routine. Okay, everyone, I'll have another post on reishi next week, and then we will go on to the next food-based supplement that might help to enhance your natural oral immune therapy. And I can see this light changing constantly. So I'll see you next time. Thanks for your time. Bye.